Good day, everyone. We are Team B2 from BSN1 King. Today, we will be presenting our assigned topic, wounds. We will begin with the definition of wounds, followed by discussion on the different types, the structures and functions affected by wounds, first aid, complications, treatment, and management, and finally, the wound healing process. Let's get right to it.
A wound is an injury to the body that breaks or damages a membrane, like the skin, often impacting underlying tissues. Wounds can result from violence, accidents, or surgery and may be caused by cuts, blows, or impacts. They are categorized as open or closed based on their cause and as acute or chronic based on the healing process. Wounds can also be classified as tidy or untidy, depending on the extent of tissue damage and contamination, which affects how they are managed and healed.
Wounds can be classified in various ways based on their characteristics. First, open wounds. This exposes underlying tissue and includes abrasion, superficial skin scrapes, laceration, deep skin tears from forceful impact, puncture, small holes caused by sharp objects, incision, clean cuts made by sharp instrument, avulsion, tissues forcibly turned away, amputation, removal of limbs, penetrating, deep injuries affecting internal structure. Second, closed wounds. Skin remain intact often from blunt force trauma, including contusion, bruising from blood leakage under the skin. Blisters, fluid-filled pockets due to friction or burns, sprain, ligament injuries, hematoma, severe bruising with blood pooling under skin. Third, tidy wounds caused by sharp objects with minimal tissue damage, such as incised, clean straight cuts, clean, sterile wounds with low infection risk. Healthy tissue, wounds with viable tissue and good blood supply. Seldom tissue loss, minimal surrounding tissue loss. Fourth, untidy wounds involve significant tissue damage and contamination, including crush, extensive tissue damage from force. Contaminated, exposed to bacteria or foreign materials. Devitalized, tissue, dead tissue complicating healing, often tissue loss, significant tissue loss requiring extensive treatment. Fifth, acute wounds are injuries to the skin that range from superficial scratches to deep wounds, causing damage to blood, vessel, nerves, and muscle with a predictable healing process. Additionally, acute are typically resulting from surgical wounds, bites, burns, or traumatic wounds. Lastly, chronic wounds heal slowly, often developing ulcers or infections such as diabetic ulcers, foot ulcer with serious complication, arterial ulcers caused by poor blood flow leading to deep tissue damage, venous ulcers result from impaired blood flow, typically near the ankle. Pressure ulcers develop from prolonged pressure on bony areas. Infected wounds that become chronic due to bacterial infection. Radiation-related wounds, severe skin damage from radiation exposure.
Wounds can significantly impact various body structures and functions, extending beyond visible skin damage to affect deeper tissues and systems. First, let's tackle about the structures affected by wounds. Skin. The skin is composed of the epidermis, dermis, and subcutaneous tissue, plays a crucial role in protection, regulation, and sensation. Wounds disrupt all these functions. Muscles. Wounds can tear, crush, or sever muscles, leading to pain, loss of strength, and impaired movement. Tendons. Tendons connect muscles to bones, and damage to them can result in loss of function in the affected limb or joint. Nerves. Nerves transmit signals between the brain and body. Injuries like lacerations or severe bruising can damage nerves, affecting sensation and movement. Blood vessels. Damaged blood vessels can cause bleeding, bruising, and reduce blood flow, which can impair healing. Bones. Severe wounds like deep lacerations or crush injuries can fracture bones or cause inflammation, often requiring surgical intervention. Organs. Penetrating wounds or trauma can damage internal organs, leading to life-threatening conditions that require immediate medical attention. Next is the functions affected by wounds. Protection. The skin serves as the body's first lines of defense against pathogens. Wounds compromise this barrier, increasing infection risk. Sensation. Nerve damage from wounds can lead to loss of sensation, affecting the ability to feel pain, temperature, and touch. Mobility. Wounds affecting muscles, tendons, or joints can impair movement, leading to temporary or permanent disability. Circulation. Blood vessels supply nutrients and oxygen to tissues. Damage to these vessels can disrupt circulation, causing ischemia and delayed healing. Thermoregulation. The skin helps regulate body temperature. Large wounds can impair this function, making it difficult to maintain an optimal body temperature. Infection control. Wounds can introduce bacteria into the body, potentially leading to local or systemic infections, complicate healing, and posing serious risk, like sepsis.
First aid is the immediate care given to a sick or injured person until professional medical help arrives. It aims to keep the person alive, prevent their condition from worsening, and aid in their recovery. First aid kit. A well-stocked first aid kit is essential for treating minor injuries on the spot and managing more serious injuries until professional help is available. It's important to be familiar with the kit's contents. Steps for wound care. For heavily bleeding wounds. First, stop the bleeding. Locate the bleeding source, wash hands and wear gloves if possible. Remove loose debris but do not pull embedded objects. Apply direct pressure using a sterile or clean dressing. Elevate the injured area above the heart if no broken bone is suspected. If the dressing soaks with blood, add a new one on top without removing the original. Lastly, seek medical help if the blood continues after 15 minutes. For non-deep, lightly bleeding wounds, first clean and dress the wound. Wash the wound with mild soap and rinse with running water. Remove any lost debris. Dry the wound with star gauze or a clean cloth. Bandage the wound with a star covering, ensuring it's small but not too tight. Apply antiseptic ointment or solution to reduce infection risk. Wash your hands after dressing the wound. Monitor for signs of infection, such as swelling, redness, warmth, and oozing. For punctured wounds, use an antiseptic solution instead of an ointment.
Wound complications can significantly hinder the healing process and pose risk to overall health. For instance, infections occur when bacteria enter an open wound, leading to symptoms like increased pain, redness, swelling, and pus. If untreated, infections can escalate to severe conditions like cellulitis, an infection of the deeper skin layers, osteomyelitis, a bacterial infection of the wound, causing fatigue, fever, and vomiting. Sepsis, a severe immune response where infection spreads to the bloodstream, potentially leading to organ failure and death. And necrotizing fasciitis, a rare but severe bacterial infection that spreads rapidly to the fascia beneath the skin. For surgical wound, complications occur at the site of a surgical incision, potentially impeding the healing process. One such complication is dehiscence, which refers to the reopening of a surgical wound, significantly increasing the risk of infection. Dehiscence can be caused by inadequate closure, poor soldering, or excessive tension from activities like cupping. Underlying conditions such as smoking, diabetes, obesity, and heart disease can further reduce blood supply and weaken the immune response, hindering proper healing. Another complication is seroma, which is the accumulation of clear yellowish fluid at the wound site. This may occur if tissue layers are not reattached properly or if there is a large dead space. Large seromas may require aspiration and drainage. An incisional hernia occurs when abdominal tissue protrudes through a weakened area in the abdominal wall at the site of a previous incision. This can result from inadequate healing, poor surgical techniques, or increased abdominal pressure from activities like heavy lifting. Finally, scarring is the body's natural response to healing, where damaged skin is replaced with fibrous tissue. There are two main types. Hypertrophic scars are raised, red scars that stay within the original wound boundaries caused by excessive collagen production. These scars may improve over time. Healing scars are thick, raised scars that extend beyond the original wound site due to continued collagen overproduction. Healings can be itchy and may grow larger over time.
Effective treatment and management of wounds require a comprehensive approach that includes careful assessment, appropriate interventions, and ongoing monitoring. First, initial assessment and stabilization. Control bleeding. The first step is to stop bleeding by applying direct pressure to the wound. Assess wound severity. Evaluate the wound size, depth, location, and check for foreign bodies. Examine for underlying injuries. Assess for potential damage to bones, tendons, and nerves. Second, wound cleaning and debridement. Cleaning. Irrigate the wound with sterile saline or water to remove debris and contaminants. Debridement. Remove dead tissue if necessary to enhance healing and reduce infection risk. Debridement helps by eliminating necrotic tissue, bacteria, and cells and stimulates growth factors. Third, wound dressing and closure. Dressing selection. Choose appropriate dressing based on wound type and severity. Loose dressing. Traditional dressing made of woven cotton and synthetic fiber. Hydrophilic dressing. Maintain a moist wound environment, protect from contamination, reduce pain, and promote healing. Alternate dressing. Absorb exudate and assist hemostasis. Foam dressings provide cushioning, absorb exudate, and reduce ulceration risk. Transparent film dressings offer a barrier against external contaminants and reduce pain during healing. Wound closure. Some wounds may require closure to facilitate healing. Sutures. Stitches for closing deep wounds. Staples. Used for larger wounds to reduce the local inflammatory response. Stir strips. Apply to close superficial wounds. For monitoring and follow-up. Signs of infection. Monitor for redness, swelling, heat, and pain. Healing progress. Assess the wound's closure, granulation tissue formation, and epithelialization. Dressing changes. Regular dressing changes may be required over weeks or months, depending on the wound type and drainage. Pain management. Administer pain medication as needed. Patient education. Inform the patient on the proper wound care, signs of infection, and the importance of follow-up visits. Lastly, we have prevention, good hygiene, and safe practices. Emphasize the importance of hygiene and safe practices to prevent wounds.
Wound healing is a multi-stage process that the body undertakes to restore damaged tissues. The process consists of four main stages. Number 1, hemostasis stage. Immediately after an injury, blood vessels constrict, or what we call vasoconstriction, to reduce blood flow and minimize bleeding. Platelets activate upon contact with exposed collagen, forming a temporary blood. A clotting cascade converts fibrinogen into fibrin, which stabilizes the clot and seals the wound within 60 seconds, preventing further blood loss and providing a scaffold for the next stages. Number 2, inflammatory stage. Neutrophils, the first immune cells to arrive, clean the wound by engulfing dead cells and bacteria through phagosynthesis. They release cytokines to amplify the inflammatory response and recruit more immune cells. Neutrophils move from the bloodstream to the wound site, ensuring it is protected and cleared of harmful substances. Number 3, proliferative stage. New tissue made of collagen and extracellular matrix is built and the wound contracts. A new blood vessel network forms to supply the granulation tissue with oxygen and nutrients. Myofibroblasts pull wound edges together, contracting the wound. Healthy granulation tissue is pink or red, while dark tissue may indicate complications. Epithelial cells resurface the wound, with faster epithelialization occurring when wounds are kept moist and hydrated. Number 4, remodeling stage. Collagen is remodeled from type 3 to type 1, and wound fully closes. Unneeded repair cells are removed by apoptosis, or what we call a programmed cell death. Collagen fibers align and cross-link, reducing scar thickness and increasing the wound's area strength, though it only regains about 80% of its original tensile strength. Remodeling can continue for a year or more. Chronic wounds may develop if healing stages are disrupted by factors such as venous disease, infection, diabetes, or aging.